Kamusta sa team? It's Good to Know Wednesday! Our topic today is the arterial waveform. Let's start reviewing the normal arterial waveform, which as we all know represents the cardiac cycle. The ascending limb or the anacrotic rise represents the rapid injection of blood into the aorta after the opening of the aortic valve. The tip of the limb represents the peak systolic pressure, which is the maximum ventricular pressure, whilst the dicrotic notch represents aortic valve closure, and the descending limb or dicrotic limb represents the pressure decline during diastole. As ICU nurses, we must level and zero the transducer at the phlebostatic axis in the fourth intercostal space at the mid-axillary line. To ensure the accuracy, releveling should occur every time the patient is moved and at least once per shift. Now let's talk about the square wave test, which is used to assess whether the arterial waveform is under or over damped. Fast flash the device and observe how fast and at what pattern the waveform returns to zero. If the arterial line is optimally damped, then one or two rapid oscillations will occur before it returns to zero, whilst an under-damped waveform will take more than two exaggerated oscillations, which can be remembered by counting the points of the U, 1, 2, and 3. Therefore, there are too many oscillations, leading to too high systolic blood pressure and too low diastolic blood pressure. The causes are too high heart rate, the line is too long, and too high vascular resistance. On the other hand, the over-damped waveform will have zero oscillations, or less than 2 with slurred details after the square wave test. This will lead to low systolic blood pressure and high diastolic blood pressure. Causes are blockage, such as blood clots or air bubbles, low flash bag pressure, and zero fluid in the flash bag. Noting that in both issues, the map remains unaffected. To correct an under or over damped waveform, aspirate the fluid, flush the line, and remove the extra tubings attached. Looking to simplify checking arterial waveform accuracy, attach a manual blood pressure cuff to where the arterial line is in situ. Inflate the cuff until the arterial trace is flat. Then slowly deflate until pulsation is seen on the arterial trace. The pressure shown in the manometer is the true systolic blood pressure. Thank you for listening.